the Dementia Care On Air podcast series. I'm your host, Anna Chodos, the Executive Director of Dementia Care Aware. The goal of this podcast is to bring you short educational moments that will help you detect dementia and care for people living with dementia. And we're especially focused on how we do that in the primary care environment and the real world. We're going to have a lot of information that mimics what we have on our website and in our other educational modules. But we're also going to have conversations with experts and other people in the community in the field of dementia care that just help us do a better job in caring for people living with dementia and connecting them and their care partners to the things they need. Welcome, everyone, to Dementia Care On Air, a podcast from Dementia Care Aware, where we promote assessment, screening, and care of people with dementia in the primary care setting, and we're here to support primary care teams to do so. I'm so thrilled to have two esteemed guests to talk today about protections and paid leave for people living with dementia and caregivers, care partners. We like to use more inclusive terms. So I'm going to let them introduce themselves. And first, I'd like to welcome Sharon. Sharon, would you please introduce yourself?
Absolutely. Hi, it's so nice to be with you. I'm Sharon Terman. I am the director of the Work and Family Program at Legal Aid at Work. And we are a nonprofit based here in San Francisco, but we help folks throughout the state of California. And our mission is to advance the workplace rights and well-being of families with low incomes. And I, in the Work and Family Program, we in particular try to ensure that families and caregivers and workers have the ability to take leave and get the accommodations they need to take care of themselves and take care of their loved ones without risking their jobs and income.
What could be more important? This is amazing. And Katie, can you say hello, please?
Yeah, thank you. This is Katherine Wutchiett. I'm a senior staff attorney at Legal Aid at Work. I work with Sharon and we provide direct services, outreach and education, and also advocate for better policies to protect workers and their families.
Well, great. So I'm thinking if I'm a primary care provider or someone working in primary care, maybe why am I listening to this today? And one thing I wanted to highlight is in our screening approach, the cognitive health assessment, we train people to ask about what their support system is, who that might be. And it might be really informal or brief, but is there someone who supports you with your medical care? Or is there someone you've designated as a formal surrogate in some way? And then documenting that. And we're putting that up front because as people who regularly care for people living with dementia, we know that this is, if not a pillar of care, it's certainly a foundation of that person's health if ultimately they are living with dementia. So I can't say enough how important I think all of this is. And I'm guessing we're going to learn a lot about how we could do a better job in primary care of both assessing and addressing needs around work protections. So that's my starting place in terms of curiosity and excitement for our conversation today. And I'm wondering why, from your guys' standpoint, why would we be talking about this now? Is there something in particular that's going on in California, or is there just more general movement in this area?
Yeah, I'm happy to take that one. And Katie, you can jump in. But I mean, first of all, this is an issue that is, it's important no matter when we talk about it. Every single one of us will at some point in our lives need care or need to provide care. And there are really important protections available that many folks don't know about that can help people stay employed, stay connected to the workforce, earning an income, supporting their families while getting through this illness or caregiving for someone. And on top of that, there are some really important movements happening right now in the law. There have been some changes to the law that have expanded protections for family caregivers, and we can talk more about that, but really exciting changes that make it possible for family caregivers to actually take the time they need to be with their loved ones and support them through this illness.
Well, that's great to hear. So what are the basics of what we should know if we're a healthcare provider, particularly in primary care, supporting people, they come to us with forms and requests for help getting leave all the time. What do you think are the basics we should know, and maybe also how that relates to any progress that has been made lately, or new opportunities in the law?
Yeah, so people who maybe have a new dementia diagnosis or their own serious health condition, they do have rights at work related to their health and rights that they can access without providing their diagnosis to their employer. So they can get changes at work. They can often get time off where they know their job will be safe. And if they need time off, they can get pay during that time. So it doesn't have to be an economic hardship. And then a lot of those rights, the rights to take time off from work and know that your job is safe, and the ability to get paid, also apply to family caregivers and family care partners. So it really doesn't have to be a choice of either going to work and knowing your family member isn't getting that support because you need the money, or quitting your job so that you can take care of your family member and then having to deal with a difficult time related to finances because of it. And going into a couple of the new changes, it was only in 2021 that smaller employers started being obligated to let their employees take time off to take care of sick family. So that was a big change that a lot of folks still aren't completely aware of. And then starting in a couple of years, just in 2025, lower and middle income workers will be able to get 90% of their income when they take time off to care or because of their own health condition. Right now, they can get 60 to 70%, which can make a big difference, but very soon it's going to be 90% of their income. So virtually as much as they would make if they were working, so that there's not going to be an economic sacrifice.
I'll just add.
Oh, yeah.
Okay, I'll just add one more. I'll add one more positive development that just last year we and other advocates helped push for, which was an expansion of the definition of family under the job protected family leave law in California. So it used to be that there was a pretty narrow list of family members that you could care for, take time off to care for, with the knowledge that you would have your job waiting for you when you came back to work. But as of this year, that list has expanded to include extended and chosen family, which is really, really important for lots of communities, including people with disabilities and LGBTQ individuals. So now really anyone that is like family to you can be someone that you take time off to care for with your job protected in California.
I'm so glad you said that, because that was going to be my question. Is there a legal definition of a caregiver, care partner, somebody who's allowed to claim this benefit? I'm guessing there has to be some connection to someone who needs care, like that's been established somehow, or their names are connected on some piece of paper. But I don't know if you can, like, how does that person request the leave?
Yeah, no, that's a great question. There are actually two different kind of ways that folks need to request leave in California. So one is through their employer, and that's who you go to ask for the time. The employer in California is not obligated to pay you, but if you're covered by one of these laws, they do have to give you the leave and continue your health insurance and bring you back to your job. And so in order to ask for leave, you just simply can go to your employer and say, I need leave because I have a serious health condition, or because I'm caring for a family member with a serious health condition. And those words, serious health condition, are really important, because that should be enough, tell your employer enough to make them know that you're covered by the job protected leave law. But you don't have to disclose the diagnosis to your employer. And so that's really important for folks to know. And your employer is not entitled to ask for that. They can ask for a healthcare provider certification, though. And that certification, again, is just to confirm, yes, my patient does have a serious health condition and they need time off from this date to this date. And then separately, in order to get paid leave, you actually have to apply to the Employment Development Department, which is the entity that administers the paid family leave program. and you can apply online or you can apply with a paper application. That actually does require a medical certification that includes a diagnosis, but again, that diagnosis doesn't go to the employer. So the worker's privacy or their family member's privacy is maintained.
Another clarifying question. I think you guys said the term small employer, and then you also said people who are low or middle income. And I'm just wondering, are there ballpark notions of that? Knowing that we're not verifying these things, but just kind of curious.
Yeah, so the law that allows folks to take time off from work and know that their job is safe is called the California Family Rights Act. So it's like the California version of the FMLA, the Family Medical Leave Act, if you've heard about it. But the California version is actually much better. So that's why we're going to talk about the California Family Rights Act instead of the FMLA. So anybody can qualify for the California Family Rights Act if their employer has at least 5 employees, if they've been working for their employer for at least 1 year, and if they've worked at least 1,250 hours within the last year, which works out to about 25 hours per week. So if somebody's being taken care of by a family member who works for a business that isn't super tiny, and they work more than part-time or full-time, and they've been there for a little while, chances are that they're going to qualify. On the income front, the folks who will qualify for 90% of their income will be those who make up to about 70% of the state average weekly wage, which is probably going to be around $70,000 per year.
I think that helps bring a lot of clarity and parameters to what we're talking about. That's super helpful. Okay, so if let's say somebody's coming to us and it's clear they're applying for FMLA or there's some indication on the form, we should also inform them that they could potentially have more rights or benefits and protected leave under California law. Would that be useful, do you think?
So that's a great question. So what they provide is pretty similar. They both let you take 12 weeks. It's more of who's covered that's different. So if somebody comes to you and they say, my employer says I didn't qualify for FMLA, or my employer says that I don't have the right to take time off, that's the time that you definitely want to let them know about the California Family Rights Act. And anytime that a family caregiver comes to you with questions about FMLA paperwork or leave paperwork from their employer, it's a really good time to bring up paid family leave, because it's 2 applications. You tell your employer you need time off, fill out paperwork for your employer, but to get paid, you have to separately apply to the EDD. And sometimes people don't know about that. So they might take time off and their job might be safe, but they're not going to get any money. Or alternatively, people might come to you with paid family leave paperwork from the EDD and get that filled out. But if they haven't talked to their employer, their job might not be safe.
Yeah, the other thing I would mention about the FMLA paperwork is that the template form from the Department of Labor for the FMLA certification does call for some information that in California, providers don't have to give. So it asks for, there's a section where you can fill out medical facts, and that could lead a provider to share more than they are required to share in order to certify leave in California. So just another note of caution to let providers know that you do not have to disclose specific medical facts or, symptoms or diagnoses in California. It's enough to just simply certify, yes, my patient has a serious health condition that warrants the care of their family member.
Sharon, I'm noticing you've now a couple of times really pointed out we should be using the term serious health condition and not getting overly specific. And I'm wondering if there's more that you want to say about why that's important.
Yeah, I think it's important because I think oftentimes people going through a serious diagnosis like dementia might rightfully fear that they will face discrimination at work if their employer knows that they have this condition or that their, spouse or loved one has this condition. Employers might make assumptions or, take action against their employee based on stereotypes about caregivers and the needs that they fear their employees will have. And so it's appropriate, and that's one of the reasons why the law provides these protections for medical privacy, is to prevent against those kinds of instances of discrimination. And so we always want to make sure that folks know they don't have to. It's their choice. If they want to, they can, but they are protected under this law and should be entitled to, the leave. And under the Family Medical Leave Act and the California Family Rights Act, it's 12 weeks of leave every year that workers can get. So for long-term conditions like dementia, it's really important that folks know that they can take up to 12 weeks every year and still have their job, still have their health insurance. And then for 8 of those weeks, they can receive paid family leave from the state if they're caring for someone. As we mentioned earlier, a lot of times people feel like, well, I'm facing this serious diagnosis. I have no choice but to quit my job. I need to be there for my loved one. I need to help them get through this. And so this is so overwhelming. I just need to quit. And we want to make sure people know before they get to that decision point, you have options. There are laws and protections in place that are designed to help you stay connected to the workforce, earning an income, supporting your family, and being there for your loved one during these times of need. That's what these laws are for.
That sounds to me like the main message of this conversation that we want people to hear and absorb. It sounds really underused. Do you guys have a sense of just how underused, and maybe also like why it's bad that it would be underused?
Yeah, we know from the data, for example, on paid family leave that about 85% of all paid family leave claims are taken for baby bonding. We know that with an aging population and, we know that people have caregiving needs in their families. And for people who are bonding with a new child, there are systems in place where it's made very easy for folks to apply, right? Their obstetricians know that pregnant people can take state disability insurance while they're recovering from childbirth, and then they easily transition onto baby bonding time. But for people with serious illnesses, it's so much more siloed, right? You go to a dementia clinic or you go to a cancer clinic, and it's really incumbent upon the patient or their family member or their provider to know and connect them with resources to apply. So it's not as easy for folks to know about, but it's super critical for people to have access to these protections, because we know that paid leave matters. It makes a difference for people's health and their well-being and their economic security. There have been studies that show that when family caregivers have access to paid leave, they stay employed, they stay connected to the workforce, which has lifelong consequences in terms of, their livelihood. And then also that their family members are able to better comply with treatment regimens, right? People show up to appointments when they're the loved one there to take care of them and accompany them and care for them. So yeah, we really want to make sure that the need is matched with the take up of this program, which is not the case now.
It's also worth knowing that whether or not people apply for paid family leave and use paid family leave benefits, they are paying for them. So just about every worker in the state has a small portion of their wages taken out that they can see on their pay stub as CASDI that goes into this fund, so that if there's ever a time that they can't work because of their health or because they need to take care of sick family, they can get this wage replacement. So whether or not people are applying for the program, they've invested in it throughout their entire working careers. So they're not asking for generosity from the government or taking money from other workers. This is money that they've paid into the system and that they have the right to and deserve to take out if they need it for them and their family.
I think I'm getting the idea and how important this is, and frankly, how underused it is. what are some of the common scenarios that you see at Legal Aid at Work, particularly if you're getting handoffs from healthcare providers, or if people have found their way to you from healthcare providers? Like, what's effective to really help people advocate for themselves around these benefits?
Well, in terms of how they get to us, we have a free confidential work and family helpline that we would encourage folks to call, both patients and caregivers and healthcare providers can call and ask for guidance. I'm a working person whose mother was just diagnosed with dementia. What are my rights at the workplace? Can I take leave? Will I have a job to go back to? Can I take it on an intermittent basis? I think that's one of the most common scenarios that we find that people have trouble navigating. Again, the program, most people use the program for baby bonding, right? And so that's typically used in one chunk of time. Whereas if you have a family member with a chronic illness, you may need to be taking off, a day here, or half a day there, an hour there. And these programs can be used intermittently or on a reduced schedule, but it can require a little bit of guidance about how to go about doing that. And so we're here to provide that kind of step-by-step guidance, problem solve with folks who may be running into barriers, either with their employer or with the employment development department. And again, it's free, it's confidential, it's multilingual. Our helpline number is 800-880-8047. And then we also have resources on our website, which is legalaidatwork.org. Things like short Know Your Rights videos about paid family leave to care for a loved one, frequently asked questions about paid family leave and job protected leave. We actually have a new guide on how to take intermittent paid family leave to care for an ill loved one, and more. So I don't know, Katie, if you want to add about specific scenarios or other resources.
Yeah, I think a lot of people reach out to us because they're afraid to ask their employer for something different than the norm. They feel like if they ask for time off or if they ask for an adjusted schedule, their employer might be mad at them. They might come up with an excuse to let them go. So having the opportunity to talk with someone in the legal field who can tell them, no, you're right. You do have this right. And your employer is not allowed to say no. They're not allowed to say that it's inconvenient. And, if your employer is annoyed or if they do say no, these are the next steps that you can take. So I think providing that background so people know not just what their rights are, but how to ask for it. And if things don't go the way that they want them to, what options are available to them and where they can turn for support can help them to have that confidence to exercise their rights when otherwise they might be nervous to make the ask in the first place.
One thing that comes up a lot in all aspects of the assessments that we do and some of the trainings is just how to work with folks with different language capabilities. Can you speak a little bit about that? I don't know if there's data on like access that people have based on language abilities, but a very common refrain in the world of caregiving is just how much of that is really the workload is placed on women, and particularly women of color. And in California, a lot of those women are lower English proficiency sometimes. So always trying to think about how to make sure we have language access for folks. I'm guessing the EDD office has access to various language interpretation, but any advice on that?
The EDD is required to provide service to folks, no matter their language. So although printed documents are only available in some limited languages, if someone calls the office, they have a language line service where they are able to get interpreters on the phone who speak a wide variety of languages. So it can be intimidating if you're limited English proficiency, but folks should know that there are resources available and that they still have those same rights. Notably, the right to paid family leave income or state disability insurance income is also available for undocumented workers. So that also should not be something that people consider to be a barrier, whether or not you are authorized to work in California. If you're paying into that fund, if you're earning an income, you can qualify for those benefits.
And similarly, a lot of folks who work in lower paid jobs may be treated like an independent contractor or paid in cash. And so they may actually not be contributing to the program through no fault of their own, but there are ways for folks who are misclassified as independent contractors to also apply and receive these benefits. And so we have some guides, step-by-step guides on our website that walk people through the process for applying for paid family leave and state disability insurance if you're undocumented, and a separate guide for misclassified workers as well.
This is so helpful. And I think the thing I keep trying to do is trying to bring it back to the clinic. Like if I'm talking to someone who I'm working with them on a diagnosis and we know more visits and care planning is going to come up. And I'm, have the opportunity to meet whoever's in the thick of it with them and hear, about how they're doing around income and support for caring for that person. I'm always usually just thinking of ways to get that caregiver more training or more income as a caregiver. But now I know I'll be thinking, if they're already employed and they want to stay employed, or if that is a good option for them to stay, as you phrase it, and I think is a really helpful way to think about it, like connected to the workforce formally, that this would be a direction to send them in.
I think in terms of we've trained a lot of those organizations. Mm-hmm. So there are some groups that are trained up, and you're right, like more connected to certain communities. But I think in terms
you could always point them in that direction if you got the referral. Yeah.
Yeah.
Okay. One thing I'm thinking about is if the person who's really looking for protections and support is the person with dementia themselves. And just wondering if you guys have any examples or case scenarios that you've worked through, because also at some point that person may become too disabled to work, and just ways we might want to think about that. Because I think we're often already working with a retired population, but sometimes we're not. And so this is a really good, especially earlier onset folks, for example, but this is a really good thing to bring up, and something I know I'd like to learn more about.
So if somebody still could keep working, but maybe with changes to their work in some way, they have the right to request reasonable accommodations for a disability. Again, they don't have to provide a diagnosis as to what that disability is. And their employer has to grant that request unless the employer can show that it would be extremely difficult for them to grant it, or this person really wouldn't be able to do any of the main parts of their job going forward. So if you're speaking with somebody and it seems like they could keep working, but there are just a couple of things that are difficult, it's worth talking with them about the specifics about their job and what parts of it they might need to change. If it gets to the point where somebody is not able to continue doing their job because of their health, or their employer won't agree to those accommodations that they would need, those changes at work that they need to keep working, then they may qualify for job protected leave from work under the California Family Rights Act or as an accommodation. But importantly, they also may be able to qualify for state disability insurance for income. So that's similar to the paid family leave program in that almost every worker pays out a small part of every paycheck into this fund so that if there's ever a time that they're not able to do their specific job because of their health, they can get their wages replaced by applying for state disability insurance. So right now they can get 60 to 70% of their income for up to 52 weeks. And starting in 2025, it'll be up to 90% of their income. So again, they don't have to be disabled from doing any job at all. It's just their specific job that they're not able to do it because of their health. So for someone who's at a point where they're no longer able to do their job and they might have to start looking ahead to what comes next, it can be state disability insurance can be a really important source of income in the interim.
Thank you. That was a really rich discussion. I really had my eyes open to, I think, the importance of these protections and also the availability. I was really not as aware, and I'm really, really appreciative for all the work you're doing. It's amazing and of incredible value. It's such a huge resource to Californians. So I really hope people listen to our conversation. I'm going to ask you as we wrap up if people sort of tuned out for a second as they were washing the dishes, if there's one thing you are hoping they'll take home. And I'll ask you first, Katie.
My one takeaway would be that if you have a family member who needs care, you don't have to leave your job. You don't have to go without income to provide them with care. There are rights that can protect your job and allow you to get wage replacement if you do need time off.
Yeah, and I would want folks to know that there are resources. If you find yourself with questions about what's available to you, what protections you might be able to access, or if you're a provider and you want to know, how do I fill out this form for my patient, or how do I make sure that my patient's, spouse is able to get all the leave she can, call our helpline, which is again 800-880-8047. It's this is Legal Aid at Work's Work and Family Helpline. It's free, it's confidential, and we're here to help folks across California.
Thank you so much. And thanks for picking up the baton of sharing your take-home point, Sharon. Really appreciate it. I want to thank you both so much, and also thank all of our medical legal partners. If people go to dementiacareaware.org, they'll see our support and inclusion of medical legal partnerships for older adults precisely because of these issues and the fact that they're really under-addressed, medical legal needs for people living with dementia and their support systems. So I'm so grateful to you both. Thank you, Katie and Sharon, for this time. And we'll definitely link to your resources. Really appreciate all the amazing work you're doing. Have a great
Thank you for having us.
Thank you.
Thank you for having us.
Thank you for listening, and to our wonderful guests. And a big thank you to our administrator and everything doer, Rita Archikova. Also, thank you to our audio editor and voice specialist, Lisa Costello. And we want to make sure you know you can get CE, CME, and MOC credits if you go to our website and click through to the podcast page, where you can do a quick quiz to claim credit. This is all possible through support from the California Department of Healthcare Services and the hard work of the Dementia Care Aware team. If you want to learn more, please visit our website, dementiacareaware.org.